Well, the doctor is in, and today we're happy to welcome Dr. William Clark, orthopedic surgeon with Ascension Medical Group, to chat with us about spinal deformities. Thanks for joining us.
Thank you for having me.
All right, so let's first start off talking about typically in the common spinal deformities that you all see.
Yeah, I'd say starting with scoliosis, where if you look at someone from the front, their spine gets shaped like an S. There's also conditions called kyphosis, where if you look at them from the side, they would get like a hunch in their back or an accentuated kyphosis. I'd say another common spinal deformity is at the bottom of the spine where it slips forward. That's called spondylolisthesis, the slippage of one vertebra on another.
And as we age, is it something that people typically get it, or how does that happen?
It can be. There's a whole myriad of conditions, most of which are pediatric. We would consider those to be idiopathic. Most of them just start for no known reason. Most adults that develop scoliosis is generally the result of degenerative conditions.
Okay, can you break that down a little bit more?
I guess I would just say most kids present with scoliosis. We can't really identify why they have it. Most of those kids are generally treated conservatively. They're usually monitored and just keep a close eye on them. Rarely does it lead to conditions or curves that require bracing. Those are usually between 25 and 40 degrees. And it's even more rare to have curves that reach magnitude over 50 that ultimately might require surgery.
And let's talk about how it affects your overall health if you do contract a spinal deformity.
Yeah, most people might be walking around right now with them.
So you're able to navigate pretty normally?
Sure. A lot of adults today, 25 to 40%, might have some degree of scoliosis and maybe know it or not even know it. It's really the big advanced curves that really warrant more invasive treatment and evaluation.
And can you talk a little bit about those treatment options, surgery, rehabilitation for those that get it?
Yeah, most of the time it's just conservative care. It would be any different care that you would be for cardiovascular disease, to maintain a healthy weight and exercise and sleep and do all the things that we should be doing anyway. Most of the time, non-surgical care would be medication or physical therapy. Every now and then maybe injections, but if the curves are advanced or if they've failed conservative care, then sometimes there's a role for surgical intervention.
Oh, go ahead.
And surgery might involve something as small as unpinching a nerve, or it might be as small as doing a fusion of one of the levels, or it might be fusing their whole spine to correct for a severe deformity.
But that's something that you should talk with your doctor, of course.
That's right.
All right, well, Dr. Clark, we're so glad you joined us. Thank you for that insightful information.